The portions of the small intestine, in order from superior to inferior, are dash. A. Jejunum, cecum, duodenum. B. Duodenum, ileum, jejunum. C. Ileum, jejunum, cecum. D. Duodenum, jejunum, ileum. The answer is D. Duodenum, jejunum, ileum. The portions of the small intestine, in order from superior to inferior, are the duodenum, the jejunum, and the ileum. The cecum is not a part of the small intestine at all but rather the beginning of the large intestine. What nerve innervates the external anal sphincter? A. Perineal nerve. B. Cluneal nerve. C. Ilioinguinal nerve. D. The pudendal nerve. The answer is D. The pudendal nerve. The pudendal nerve innervates the external anal sphincter and is responsible for a person's ability to voluntarily control defecation. Dysfunction of the pudendal nerve has been associated with fecal incontinence or constipation. The other nerves listed are all part of the pelvic floor but do not directly innervate the anal sphincter. Absorption of nutrients in the small intestine occurs mainly in the underscore. A. Duodenum and ileum. B. Ileum and cecum. C. Duodenum and jejunum. D. Jejunum and ileum. The answer is C. Duodenum and jejunum. The majority of absorption of nutrients in the small intestine occurs mainly in duodenum and the jejunum. The ileum is still a site of some absorption, though it is far less than nutrient absorption in the superior parts of the small intestine. The cecum is part of the large intestine. What vein carries the nutrient-rich blood from the gastrointestinal system to the liver for processing? A. The hepatic portal vein. B. The splenic vein. C. The ileal vein. D. The left gastric vein. The answer is A. The hepatic portal vein. The hepatic portal vein is the main vein that carries nutrient-rich blood from the digestive tract to the liver for further processing. The other veins listed are all smaller veins that drain the stomach, small intestine, and spleen into the portal vein. What is the name of the muscular sphincter that keeps stomach contents from regurgitating into the esophagus? A. Ileocecal valve. B. Upper esophageal sphincter. C. Pyloric sphincter. D. Lower esophageal sphincter. The answer is D. Lower esophageal sphincter. The muscular sphincter that keeps stomach contents from regurgitating into the esophagus is the lower esophageal sphincter. The upper esophageal sphincter separates the esophagus from the pharynx, the pyloric sphincter separates the stomach from the small intestine, and the ileocecal valve separates the small intestine from the large intestine. The most superior part of the stomach is the dash. A. Fundus. B. Rugae. C. Body. D. Pile or cantrum. The answer is A. Fundus. The areas of the stomach, from superior to inferior, are the fundus, the body, and the pile or cantrum. The rugae are folds in the stomach that increase its surface area and expandability. What ligament attaches the liver to the abdominal wall? A. The falciform ligament. B. Ligamentum flava. C. The ligament of Treitz. D. The splenorenal ligament. The answer is A. The falciform ligament. The ligament of Treitz suspends the duodenum, while the splenorenal ligament goes between the left kidney and the spleen. Ligamentum flava are ligaments present in the spinal cord. Which of the following digestive enzymes breaks down starches? A. Lipase. B. Amylase. C. Protease. D. Peptidase. The answer is B. Amylase. Amylase enzymes, produced by the salivary gland and the pancreas, break starch down into simple sugars. Peptidase and protease enzymes break down proteins, while lipase enzymes break down lipids. Which of the following substances helps emulsify fats during digestion? A. Hydrochloric acid. B. Cholecystokinin. C. Bile acids. D. Pancreatic lipase. The answer is C. Bile acids. Bile acids, produced in the liver and stored in the gallbladder, help emulsify fats during digestion. The process of emulsification makes fats collect into small droplets, increasing the surface area of ingested lipids and increasing the ability of pancreatic lipase to break fats down into fatty acids and glycerol. Hydrochloric acid aids in the breakdown of proteins in the stomach, and cholecystokinin is a hormone with a wide variety of functions in the digestive process, including the stimulation of the release of bile, though it does itself not play a role in emulsification of fats. Which of the following would be a normal gastric pH? A. 4.0. B. 1.2. C. 4.8. D. 2.0. The answer is D. 2.0. Normal gastric pH ranges from 1.5 to 3.5. This highly acidic environment aids the stomach in denaturing proteins, a fundamental part of digestion.